We are joined by Susie Kirvan and Tina Perry. Susie is a nurse educator and harm reductionist for the North Shore Health Project, and Tina is a health educator and does outreach for North Shore Health Project. Thanks for joining us, ladies.
Thank you for having us. Yeah.
So right off the top, can you just explain what the North Shore Health Project is for folks who've never heard of it?
Absolutely, yeah. So the North Shore Health Project has been around for a long time in the community. So they offer HIV case management on one side, and then we work for ONESTOP Harm Reduction Center, which is a syringe exchange and harm reduction program that serves the community of drug users here in Gloucester in the greater Cape Ann area.
Gotcha. And can each of you just define what your titles mean?
Absolutely.
Yes.
You want?
Sure, I'll go and get it over with. So I just started working at ONESTOP a month ago. So they added on an RN harm reductionist so that we can kind of try to expand services. So I go on outreach 3 days a week, street outreach, and I can do wound care on the street, offer services, Narcan training. And then we want to try to collaborate with the health center in Gloucester so that we can try to get MAT for people on the spot. So we're hoping to kind of collaborate with them so that I can help in that situation as well.
Well, I'm a harm reduction specialist and health educator here. So what that means basically is I'm kind of covering all of the services we offer. So sitting at the front of our program and doing syringe exchange with folks who come in, offering harm reduction counseling and education around safer sex supplies, safer use supplies. I also do like Narcan distribution, Narcan training, Narcan refills, taking overdose report backs from community members and organizations as well. Also, I do street outreach with Susie. So we travel to different parts of the North Shore up here in Cape Ann and meet people where they're at on the street to engage them in services, which is really beautiful and rewarding. That's like the favorite part of my position. I also do a lot of like risk reduction counseling with folks, as well as like testing. So I'm trained in phlebotomy. I do HIV, Hep C, and STI testing for folks here. And then also like getting folks connected if they would like to like do detox referrals. So I have helped folks call programs, get them a bed, offer transportation as well. And then similar to Susie, getting folks connected to MAT clinics if that's something again that they express wanting. So really just offering support and cultivating community within the greater Gloucester community.
Can you guys tell us what has happened with the flow of drugs during COVID?
Absolutely, yeah. So the drug supply up here from the reports that we've received from community members has been pretty inconsistent. Folks are still able to find drugs, but what we're really seeing up here and really, you know, across the country is a drug poisoning. So we're finding fentanyl in basically every street drug at this point. So we've gotten a lot of reports from folks who might not be opiate users that are testing their drugs with fentanyl test strips, and they're finding fentanyl in crack cocaine and crystal meth and powdered cocaine, as well as benzos. So there are a lot of pressed pills out on the street right now. And if you think you're buying a Klonopin or a Xanax off the street, those are actually cut with fentanyl as well. So the unpredictability around what you're actually purchasing and then, you know, what you think it is and what you're actually getting has been super unpredictable. And we're just seeing that pop up more and more during COVID.
And are you seeing more overdose because of that?
Absolutely, yeah. Which we're, you know, super lucky that we're able to provide fentanyl test strips and education around how to use them to folks. So people are definitely keeping themselves as safe as possible. But again, you know, COVID presents a whole new set of issues around folks maybe being a little more secluded than they used to be. So the potential of maybe using alone, as well as having interruptions in their medicated assisted treatment. So, you know, if you miss a couple of days on the clinic and you use a street opiate because of the tolerance decrease, which happens, you know, within 3 days, your tolerance will go down. If you're getting something on the street and you're not aware exactly of what it is, that does put you at risk of overdose. So we're definitely getting more of that during COVID.
And this is part of what your educational process is, letting people know these street drugs may not be safe. And then are you providing more naloxone because of this?
Yeah, so we definitely are giving folks who need it like as many doses as they request. We always want people to be prepared, and we do really honor the fact that the community members here feel safe and comfortable enough with us as staff in a program to share this data with us about the street supply. So we are able to do like harm reduction tips of the week and community announcements here regarding the street supply, just to keep everyone as informed as possible.
Great. So it sounds like your jobs must be really challenged by COVID, but also the lives of your clients must be super challenged. Do you want to talk about that?
Yeah, I mean, I think in the drug using community and the homeless population has been it's already a marginalized population. And with COVID, it's been extremely difficult. I mean, I basically cried every day on my way home when this first, you know, was going on, and I had to kind of pull it together a little because people are not able to do anything that is suggested of them when you live outside. You can't shelter in place. You can't wash your hands for 20 seconds. You can't go to the bathroom inside. All the public access that people had, the limited public access if you lived outside, was shut off to them immediately. So even if you went to the library to just get out of the rain, or you went to the soup kitchen, and they were still open, but I had to watch people try to find this little space where they could try to eat in the rain outside after they got their food. You know, they didn't have any place to go to the bathroom. Maybe they went to McDonald's to hang out for an hour and they couldn't go there. They just were shut off from everything. So it was extremely difficult at first, and I think it's gotten a little bit better, but that population is still struggling. Very, you know, it's a struggle daily. I can't imagine having to go through, you know, COVID and be living outside. It's just not something I can, you know, I mean, I don't know, I get very emotional about it, so I apologize. It's been very difficult for the people that I serve. Like, I'm here to serve them, and it's difficult, and we just try to get them anything that we can that they need. But there's a lot of things that they don't have that they need, so.
Absolutely, yeah. And I think to speak more towards like folks who were working on their recovery, again, self-identified recovery, but it's been really difficult for a lot of folks to access meetings like NA and AA. Like if you were going to meetings in person and now they're only happening virtually or not at all. Not everyone has an internet connection, a smartphone, a computer where they can access that virtual support. So that's been really difficult for people. You know, this is a really stressful, hard time for everyone, including sponsors. So like some folks have had some difficulty getting in contact with their sponsors. So again, not having that support around them while they're, you know, going through a really stressful, traumatic time, and this pandemic has been difficult for folks as well. And just surrounding services, you know, even keeping up with their clinic schedule sometimes when there isn't reliable transportation or other community supports that are available because things are closed right now has been hard for folks also. So, you know, we know some people who might not always be able to get to the clinic, so they might go back to, you know, street drug use due to that. So it's been really hard all around.
Well, and I was going to ask too, I'm sorry, Heather, but how is staff morale throughout all this when you see, you know, what people are going through and you're doing, you know, everything and more that you possibly can to help, as now we're into, you know, the 6th month of basically the beginning of, you know, the new normal?
Yeah, I think just speaking for myself personally, it was definitely difficult at first, just because like no one really understood what COVID was or how it was spread, and it was just like a lot of unknown factors. I definitely feel more positive now, just because a little more is known, and also, you know, as a program that remained open and still offered full services throughout the pandemic, being able to like offer a safe space for people where they might not have anywhere else to go and still be able to provide all of the services here and whatever knowledge I had to support folks. Like, I really enjoy doing that. I'm a person who like, I need to be in action all the time, or that stresses me out. So I think for me, my morale is pretty high, just knowing that I can be a provider and staff member here to assist folks with whatever they need.
It sounds like you guys are really the lifeline for this community too. The fact that you're getting out there and meeting them where they are is just so important.
Absolutely, yeah.
So Tina and Susie, if people want to learn more about the North Shore Health Project, how can they go about doing that?
Yeah, so you can visit the North Shore Health Project website. We also have a ONESTOP Harm Reduction Facebook page. If you just search ONESTOP Harm Reduction Center. If you have Instagram, we do have an Instagram account as well, where we post flyers for like different Zoom trainings that we hold weekly. So we do really consistent like overdose response and reversal trainings via Zoom. And that Instagram handle is ONESTOP Harm Reduction. And we also have a confidential and anonymous like cell phone line that we use for outreach that folks can call or text to connect with us. Again, completely confidential. And that number is listed on all of our social media and our website. But that number is 978-381-3170. And we have that phone Monday through Friday from 9 a.m. to 6 p.m. So big window of time for people to reach out to us if they need services or even just want support right now. We're here to just talk to folks through whatever they need help with.
Well, on behalf of the community, we really appreciate your efforts and what you're doing. We would love to check back with you sooner than later, especially now as the weather's turning colder, and I'm sure that brings up another multitude of issues you have to deal with. So yeah, so Susie Kirvan and Tina Perry, thanks so much, and take care and keep doing what you're doing.
Awesome. Thank you so much.